Good morning, my name is Jennifer, and today we are going to be discussing race and gender and the impact that those two things have on diagnosing and the treatment of mental illness. Disparities in the healthcare system are more common than many people think. Racial inequalities in healthcare access and quality occur when people lack equal access or opportunities to healthcare due to their income levels or the environment in which they live. One contributor to racial disparity with regard to mental illness is the lack of cultural competence or general overall awareness with healthcare providers and clinicians. As mentioned by the National Library of Medicine, training is a vital part for many clinicians and professionals. Many times, clinicians and providers do not understand their own biases, whether that be unintentional. They lack cultural competence and they lack awareness of the disparities within the healthcare system. Due to their lack in knowledge regarding this, they are unintentionally contributing to continuing the disparities within healthcare system, which includes mental health treatment. Also, without their acknowledgement of their contributing to this issue, they also can't be a part of the solution to help end disparities. So training and awareness is very vital for the people who provide treatment for mental health. Another contributing factor of mental health disparities for racial, ethnic, and sexual minority groups include cultural stigmas regarding mental health care, discrimination, and just, again, a lack of overall awareness about mental health. Also, a lack of cultural understanding by mental health providers can contribute to underdiagnosing or misdiagnosing mental illness in people from racial and ethnic diverse populations. Other factors that assist with this include language differences between the patient and the provider, stigmas of illnesses among minority groups, and then cultural presentation of symptoms. This information was obtained from the American Psychiatric Association. Also, people in racial and ethnic minority groups are less likely to seek mental health care for various reasons, such as they have a distrust in the mental health or the healthcare system. Maybe they have reached out previously to try to get some kind of support, treatment, or assistance, and they were turned away, or they had a bad experience. They could lack transportation to continue going to ongoing treatment, or they could just not have insurance or the money to pay out of pocket. A lot of times, mental health care, if you don't have insurance, some agencies or organizations will offer you the opportunity for treatment if you pay out of pocket. And those treatments are usually expensive. So if you don't have insurance or money to pay for that, that could also be another discouraging contributor to seeking treatment. Additionally, society adds to the stigma of mental health treatment as it relates to gender. Typically, society has painted men to be the provider of their families and to not show weakness or emotions. So when you think about mental health or mental illness treatment, mental health treatment, you're more likely to see a woman seeking services than a man. And this is due to the cultural expectations of society that are placed upon men. Generationally speaking, young boys are taught that they should not cry or show emotions, or express themselves in such a way where they would be viewed as weak. Depending on, the race of this man, you could also be looking at some sort of intersectionality where you also have they're part of a minority group and they're a man. And so that would just further add to the stigma of seeking treatment. And this is especially more so for Black males who are less likely to seek treatment, as culturally speaking, that's not something that they would generally do because they don't want to look weak. Lastly, this whole conversation discussion board, it really speaks to, the system as a whole, the healthcare system, mental health treatment, just disparities in general. So as a whole, we have to work on changing limitations to access for all people, despite their cultural background, or if they're from a minority group, because we have seen that these disparities are leading to shorter lifespans for ethnic, racial minority groups, and for men especially, they have a higher rate of self-harm because they're less likely to seek out services. Thank you.